Hello, everyone. My name is Darren Wijaya. I'm a resident at the Loma University Medical Center, and I've collaborated with the Division of Medical Oncology and Hematology in creating this project. I'd like to start by thanking the MOASC committee for extending to me this opportunity. So today, I will be presenting our meta-analysis titled Comparison of Fresh versus Frozen Allogenic Peripheral Blood Stem Cell Grafts in Hematopoietic Stem Cell Transplantation. As many of you know, the standard approach to stem cell transplants involves transplanting fresh donor cells following a conditioning regimen. However, during the COVID-19 pandemic, logistical challenges such as donor availability and potential exposure risks necessitated the widespread adoption of graft cryopreservation. While this approach allowed for timely transplantation, its effect on short and long-term outcomes remains a subject of debates. Given the mixed findings in prior studies, we conducted a meta-analysis of 11 retrospective studies sourced from PubMed and Embase to compare the effects of fresh versus cryopreserved grafts on key transplantation outcomes. To ensure a robust analysis, we assessed effect sizes using HSCT, evaluated heterogeneity using the Q-test and I-squared statistic, and examined the influence of sample size with R-squared. For hematopoietic recovery, we analyzed CD34 cell counts, specifically post-thaw counts for frozen samples, time to neutrophil engraftment, defined as ANC greater than 500 cells per microliter, and time to platelet engraftment, defined as platelet greater than 20,000 cells per microliter. Additionally, we assessed long-term survival outcomes, including overall survival and relapse-free survival at the 1 and 2 year time marks, using log odds ratios and variances pooled via an inverse variance weighted fixed effects model. Our findings indicate that short-term hematopoietic recovery outcomes show minimal or negligible differences between fresh and frozen grafts, although heterogeneity was high for some parameters. CD34 counts slightly favored frozen grafts, but due to high heterogeneity and no significant association with sample size, this finding remains weak. Neutrophil engraftment demonstrated a small but statistically significant benefit for fresh grafts, though heterogeneity was also very high, suggesting study variations. Platelet engraftment showed no meaningful differences between fresh and frozen grafts, as well as low variability. While short-term hematopoietic recovery outcomes did not exhibit major differences, long-term survival outcomes strongly favored fresh grafts. Overall survival was significantly higher in fresh graft recipients, with a pooled odds ratio of 1.38 at 1 year and 1.39 at 2 years. Relapse-free survival showed a modest benefit for fresh grafts, with odds ratios of 1.14 at 1 year and 1.14 at 2 years. As illustrated in Figure 1, the bar graph with error bars highlights these odds ratios, making it clear that while short-term hematopoietic recovery remains largely unaffected by cryopreservation, long-term survival outcomes significantly favors fresh grafts. In summary, our meta-analysis suggests that while no remarkable differences are seen with short-term hematopoietic recovery, long-term outcomes strongly favor fresh grafts, with a significant survival advantage in overall survival persisting at both 1 and 2 years, and a modest benefit in relapse-free survival. These findings highlight the clinical trade-offs of cryopreservation. While it remains a viable and necessary option, particularly in pandemic scenarios or logistical constraints, fresh grafts appear to offer superior long-term outcomes. This underscores the need for further prospective studies to better understand the full impact of graft cryopreservation in allogenic hematopoietic stem cell grafts. Thank you for your time, and I hope you enjoy the rest of the conference.